Hello everyone, my name is Siqi. Today I'm going to introduce my project, The Role of Growth Hormone in Arthritis Development. First, let's take a closer look at growth hormone and its physiologic function. Growth hormone, also known as somatotrophin, is a key regulator of the skeleton development and maintenance. It is produced by the pituitary gland and exerts its effect directly or indirectly through the insulin-like growth factor 1, which preliminary synthesis in the liver. Besides its skeleton effect, growth hormone also have metabolic functions. It has a well-known diabetogenic effect, meaning it's like inhibits insulin action. And there's also some growth hormone-related disease in the clinic. First is acromegaly, which happens when too much growth hormone is produced, causing the excessive growth, metabolic problems, and a shorter lifespan. Many acromegaly patients also experience the joint pain, which may be linked to the osteoarthritis. And Leber syndrome is totally opposite. It occurs when growth hormone action is missing, leading to a short stature, but surprisingly, they have longer lifespan and a lower risk of diabetics and cancer. This disease shows how growth hormone levels strongly affect the growth, metabolism, and the joint health, which is why we study its role in arthritis. Next, I will introduce the animal model related with growth hormone. So in the past, in the past decades, Dr. Kopchik's lab have developed severe mouse model to study the growth hormone and its receptor. Our lab is collaborate with his lab to using this mice model to understand the growth hormone role in OA. Here we have few different mice model. BGH mice have on the left has like high growth hormone level, leading to increased IGF-1, faster growth, and a shorter lifespan. White type mice just have like normal growth hormone function, severe as a control group, and the GHA mice have lower growth hormone signaling due to the growth hormone receptor antagonist, mimicking the effect of the FDA-approved drug picovizumab used in the acromegaly patient. THR German knockout mice completely lack of growth hormone receptor, resulting in very low IGF-1, insulin resistance, and an extended lifespan. So in our lab previous study, we also found a clear difference in OA progression in this mice model, showing that growth hormone plays an important role in joint degeneration, in joint health. BGH mice, like with high growth hormone level, develop more severe OA around 13 months, and the GHR German knockout mice, which lack of growth hormone signaling, are protected from the OA even at 2 years old. GHA mice, which like reduce the growth hormone action, but not that obvious compared to the GHR German knockout mice. They also show less OA damage at 23 months. These results suggest that too much growth hormone may worsen the OA, and while lower growth hormone level may help protect the joint. So after observing this difference in OA severity among our growth hormone mice model, the next logic step was to further investigate the mechanism behind this effect. Our first research aim is to determine how blocking growth hormone action in cartilage through the cartilage-specific deletion of growth hormone receptor, like how they affect the OA development. To explore this, we focus on two key questions. First, does the cartilage-specific deletion of GHR protect BGH mice from developing OA? Since the BGH mice develop more severe OA due to the high growth hormone level, we want to see if removing growth hormone signaling in cartilage can like counteract this effect. Second, how does the growth hormone deficiency affect the chondrocytes metabolism in vivo and in vitro? This will help us understanding the cellular change driving the OA progression when the growth hormone signaling is blocked. So to answer our research question, we want to generate BGH mice with cartilage-specific growth hormone receptor deletion. However, This process was quite challenging due to the breeding difficulties. So after 1 year, we successfully generated the GHR cartilage knockout BGH mice. As shown in this image, the GHR cartilage knockout BGH mice are smaller than the normal BGH mice, but larger than the Y type and the GHR cartilage knockout mice. Besides that, regarding the risk factor of OA were separate in age and obesity and injury. We started to study the post-traumatic osteoarthritis. Our lab using a method called the anterior cruciate ligament rupture. The anterior cruciate ligament is a band of the connective tissue in the knee that connect the tibia and femur. Previous study have already shown that if you rupture this ligament, the mice will develop the progressive of OA. So our whole experiment designs like at 8 weeks of age, the mice will receive the tamoxifen injection to induce the cre-mediate recombination and the deletion of GHR in cartilage. At 10 weeks, we induce the acer rupture by using the TPR comprehension model, which can perfectly mimic the post-traumatic OA. From 11 weeks onward, we conduct a weekly knee hypergesia test for 8 weeks 8 weeks to assess the pain sensitive following joint injury. At 5 months of age, we harvest these samples, collecting the cardiac, blood, left and right legs, and articular cartilage for the further analysis. The collected tissues will be analyzed using the microscope for the bone structure changes and the histologic staining to assess the cartilage degeneration. Serum analyzed to measure the inflammatory markers and adipokine, metabolic miss, and iron sequencing, and the lipidomics to examine the molecular change associated with OA progression. So here we already have some excited preliminary result as shown in the 3D reconstructions. On the left, we observe that the female GHR German knockout mice develop significant few osteophyte following the acer rupture compared to the third Y type mice. This finding is also supported by the quantification showing on the right, where the female knockout mice show a lower normalized osteophyte value, which with the statistic significant. If you'd like to hear more about this project and ongoing discovery, please consider select me as a finalist. I'd love to share more details in the next presentation. Thank you for listening.